ago, put in place voluntary salt reduction program, which is not directly related to childhood obesity, but is another example of this kind of policy approach. And it's sort of coming in and out of the policy discussions whether or not we should even put in place a tax on sugar-sweetened beverages, and if we were to do that, how we would do that, and if we could actually leverage those funds to try and support programs that specifically deal with obesity. In terms of access, we have countless programs, too many for me to go in great detail describing, but they're all written about in the report, to try and increase access to fresh foods, healthy foods in neighborhoods where access to them is really limited. One key example of that is our new initiative called the Fresh Initiative, which uses zoning and tax incentives to get supermarkets to locate new stores in areas where they have high rates of obesity and diabetes, and where there's limited availability of fresh foods. Physical activity in parks and housing, we're far behind you in terms of supporting and promoting active travel, but the mayor has discussed putting in place new programs to do things like rip out concrete schoolyards and try and make them more turf, cover them with turf and make them more friendly for sport. In terms of the next one, reinforcing WIC, that stands for Women, Infants, and Children. And food stamp offerings, these are basically food safety programs where we provide food or money that people can use just for food to targeted populations. And in New York City, the Department of Health has instituted a number of really creative programs trying to make it so that people who receive these kinds of benefits can not just use them, not only use them at the grocery store, but can use them at farmers markets and other places where it might be more fun to shop, where they might find better quality fresh foods. The Department of Health has also put in place some educational programs for doctors to try and enable the medical workforce in New York City to better be able to communicate with parents who have overweight children about how to address that issue. And we have some pretty aggressive social marketing campaigns about not drinking yourself fat and things like that. So now I'll quickly go through the recommendations. I'll just point out in the report we have them very briefly listed in the executive summary, but then in the back of the report there's a paragraph or so underneath each recommendation that relates it to more detailed examples in either city. I won't go through all of that now, but if you want to hear more about them, read more about them, that's where you can do so. So just a tiny bit about our approach, building on what Eileen has said. The recommendations come out of looking at recommendations in key reports like the Healthy Weight, Healthy Life strategy, looking at things like the Mayor's Health and Quality strategy. Here, in New York and in the US, the Centers for Disease Control and the American Institute of Medicine also recently put out guidelines on policy recommendations for cities around obesity. And so we gathered all of these. We looked at the sort of the evidence base in terms of academic journals, so we did a review of that. But we also put into our evaluation criteria, strategically looking at what either city is doing and saying, well, you know, if London can have an urban agriculture strategy that is citywide, why can't New York? And if one city is doing something, shouldn't that be evidence enough that the other city could at least think of that as a feasible strategy to try? So while some of these may seem like very aspirational recommendations, they are really grounded in this kind of evidence. So the first one, using zoning authority and land use review processes to limit access to fast foods and the promotion of unhealthy foods to children. This is sort of building off of what I've described New York City is doing with its supermarket initiative, and also, not the supermarket initiative, this is building off of what we've seen here with the Walden Forest initiative to limit the density in fast food zoning, and to try and limit the promotion of those kinds of foods specifically to children around schools. The next one is building off of the New York City's supermarket initiative. So we want to use zoning and tax incentives as well as city-owned properties to increase the availability of healthy, affordable, and culturally appropriate foods in neighborhoods where it is limited. So here we want to not just do exactly what New York City is doing promoting supermarkets, but also in New York we have a growing movement of food cooperatives where people are sort of starting their own consumer-owned grocery stores where they can stock whatever they want to stock. I belong to a food cooperative. I know when I go into my store, there's nothing in the store that's genetically modified. You can't do that when you walk into a conventional grocery store. So really trying to support those kinds of initiatives both at the city level, but also using city policy to support things that communities are doing for themselves. We want to also incorporate active design principles into building codes, housing strategies, and neighborhood planning. So New York City has just launched this fall our active design guidelines, which sort of take the best of what we know about how do you promote activity by building it into your architecture, building it into your neighborhood planning, building it into your city planning and transport strategies. We want to encourage London to take up this kind of thinking. London has its play strategy. Our active design guidelines don't have anything specific in them about play.